Riverside Healthcare puts the health and wellness information you need well within reach.
Hello, listeners, and thanks for tuning in to the Well Within Reach podcast brought to you by Riverside Healthcare. I'm your host, Liz Unruh, and joining me today is Peg Spear, who's the marketing manager with Riverside Senior Life Communities. Thanks for joining us today, Peg.
Well, I'm happy to be here.
So we're going to be talking a little bit about the continuum of care in senior life community. Before we jump into that, can you tell us a little bit about your background in the senior life living realm?
Well, I've been working in senior life for over 12 years and in marketing for over 30 years. So I'm excited about working in senior life because I just feel like the journey is worth the effort.
Yeah, for sure. And I know it's a great community that you work in and beautiful setting. So talking a little bit about what care continuum means when it comes to a senior life community, you hear care continuum and you're like, all right, what does that mean? So can you tell us what the different areas are within that continuum?
Yes, absolutely. I'd be excited to share that story. So we start out with what's called independent living. And that's where seniors who have been living on their own in their own homes have come to the point where managing a house is just getting to be too much, yard upkeep and housekeeping and just all of that in general. So they enter the continuum as an independent living resident. And we start taking over some of those responsibilities like housekeeping and meal preparation and such. And then on top of that, we provide a variety of socialization and activities. And we have such a beautiful community with swimming pool and a hot tub and physical fitness center. So it starts in independent. And then as we continue along in our journey, we might get to a point where we need a little bit more help with managing things like medications, etc., or like assistance with daily living, showering, dressing, grooming, toileting. Our life gets to be a little bit more challenging as we get a little bit older, so then assisted living might be the next step. In some situations, our memory can be affected, and in that regard, we also offer memory care, and that program provides our residents with an environment that is conducive to their journey with the memory issues. And then if need be, there's always the next step, which is skilled and or a nursing home level care.
Okay. So there's lots of different areas. So like you mentioned, the first step is independent living. So why would someone choose to go into a senior community to live in an independent living versus just choosing to go into an apartment to not have that long care and things? Why would they choose to go into that type of community?
I think the main reason is our socialization aspect. A lot of our folks, they've lost their partner or their dear loved one and they are alone. And if they move into an apartment complex that doesn't have any organized social functions, they continue to be alone. And that isn't giving them the stimulation or keeping their mind active and just being involved in different things instead of just being sedentary and not providing any stimulation physically or mentally.
For sure. I know that socialization is a big part of not falling into a depression or those things, being able to socialize and have activities to go to. I think that that's really big. So if you're in independent living, how would you know it's time to transition to the next step in the continuum?
Well, most of the time, our staff is always kind of watching our residents, and we might pick up on a few concerns. If, say, somebody is having an occasional fall, starting to maybe be a bit more forgetful, and just struggling with things like dressing. I mean, as we get older, bending over and putting on shoes can be a real challenge, and it could also be a real risk. So that kind of gives us some insight as to the fact that maybe things are changing and we need more assistance.
Yeah, that definitely makes sense. So can you talk about the major differences between assisted living and independent living?
Sure. In assisted living, we do provide a much larger amount of services. So in independent, we don't provide any medical care services, But in assisted, we can provide medical care services. So we can assist with medications, we can assist with activities of daily living. They do get provided 3 full hot chef prepared meals a day, housekeeping, laundry, all of these things are taken care of. And then as their physical needs change, say if they need diabetes management, wound care, colostomy, or any of those other things that can definitely be more challenging,
Yeah.
those can be managed in our community at our assisted level because we have nurses on our team 24 hours a day.
Yeah, that's definitely a good differentiation when you start needing a little bit more of that help and that medical care. It's that time to transition to assisted living because those services are available. So, if you were in assisted living and you decide, okay, maybe I need more care than assisted living can give me, so I need that long term type of care or memory support, what does that transition look like?
Okay, so when we're in the assisted setting, we have that nursing team 24 hours a day. So we're watching and we are able to notice if someone is starting to struggle with memory and possibly becoming a risk to themselves or others simply because they just can't keep track of the day. And the short term is generally what goes first. They might have long term memories, but they don't remember. They might ask you 6 times in an hour whether or not they've eaten breakfast. Well, now we're determining that there's definitely a need for enhanced care at the memory level.
Okay. That's definitely something I know starting to ask lots of questions over and over again is definitely a trigger for dementia and that need for the memory support. Just a quick break here for a message. For more than 30 years, Riverside Senior Life Communities has been providing remarkable living experiences and quality care. From Westwood and Miller Healthcare in Kankakee to Bourbonnais Grove and Bourbonnais, you are sure to find the level of care and vibrant lifestyle you or your loved ones are looking for. To learn more or to schedule a tour, visit riversideseniorlife.org. And we're back. So, traditionally, where do you see people entering this care continuum?
Well, optimally, I would love to see them come in at the independent level. That is where they can begin to see that this is not a nursing home setting. This is a resort, all-inclusive resort for the rest of your life. I mean, we just have so many beautiful amenities, such a beautiful campus, providing walking paths. We even have a dog park for our independent living residents that can still care for a dog or a pet of some sort. We also have, like I said, that swimming pool and the heated spa jacuzzi. Fitness center, we have a billiard room, and of course, fine dining with chef prepared meals, and just all these different activities and outings and things to do. Optimally, I'd love to see them come in at that level.
Yeah, that would definitely be the right level to come in at, but it's never too late, correct, to come into the care continuum. So if someone came in at, if they decided maybe, oh, we wanted to start an independent living, and as you start talking to them, are there times where you suggest maybe going to a different level of care?
Absolutely. And I strongly encourage doctors and professionals to take this into account. Oftentimes, family will start to notice that some things are just going untaken care of. I mean, they're not taking their medications, they're not showering, they're not eating properly. But family might have a hard time getting that point across to a loved one without the loved one feeling insulted.
Yes, I
However,
understand that.
but if a doctor steps in and says, it might be time to look at assisted living. And again, assisted living provides you with a private apartment with that all-inclusive resort-like lifestyle. It's not a nursing home, but yet there's somebody there 24 hours a day to take care of you if you should need assistance. Because being alone without help, and even if you have, say, a life alert of some sort, it still may not be quick enough. So it's a better environment to be in, say, if an emergency arose.
For sure. And we definitely encourage people to take tours before you need it, because there are people that enter into the care continuum that someone's fallen because they've been alone and now they can't necessarily live by themselves or take care of themselves. So they might be coming from like a rehab program and you're just trying to find somewhere to put mom or put grandma, and touring before gives you that opportunity to see what different communities have to offer, for sure. So we've touched on a lot of the great amenities, but if someone were looking at a community like Riverside that has the full continuum of care, why should they consider this type of community versus somewhere that's just a nursing home or just assisted living?
Well, I think it makes the transition so much easier as you continue through the continuum. Like you said, a stimulating experience such as a fall or a health situation that's landed you in hospital and now you've gone to rehab and now you just absolutely don't have an option and you cannot go home. So you're going to be coming in the middle and you're going to be more apprehensive. Whereas if you're already there, you're going to be seeing the assisted side because our different levels mix together. We do events together. We do activities together. And their independent living friends who do transition over, they continue to go and visit them and see them. So it's a family.
Yeah, I think that's really a great benefit. You're not moving away from your friends that you've made. If you've started an independent living and you move to assisted, you can still see those same people because you're in the same building. I think that's really a big thing. We've talked a lot about a great variety of things about the continuum here, but is there anything else you'd like to add?
Well, I encourage people to start looking before you're ready because then you will see that it's just a wonderful environment. And I often joke, a lot of folks come in and they're like, can I still go out? Can I go to the store? Can I do this? Can I do that? And I'm like, this is not prison. This is a home and it's your home and you bring your own furniture and you decorate it the way you want to and you put your mementos in there and you make it your home and we want to make it your home so that you're completely comfortable. And it's a wonderful resort-like environment, but with a family atmosphere.
Yeah, and I think that's really important, having that family and getting to know your neighbors. It's just a really great benefit to living in a senior life community that has that continuum of care. Thanks for joining us today, Peg. We've really enjoyed having you and talking about the continuum. And thank you, listeners, for tuning in to the Well Within Reach podcast with Peg Sphere, Marketing Manager at the Riverside Senior Life Communities, and your host, Liz Unruh. To learn more about the Riverside Senior Life Communities or to schedule a tour of one or all of our beautiful locations, visit riversideseniorlife.org.